Welcome to another installment of the World AIDS Museum and Educational Center's Spotlight Series. And we are so lucky to have Dr. Howard Grossman here this day on June 2nd. Dr. Grossman has had a long history in working with HIV from the early days to the present. And today we get to talk about his experiences, his history, and his advice of where we're going and what we can do. So, without any further ado, I'd like to introduce Dr. Howard Grossman to the Spotlight series. Thank you so much for being here today and being a part of this. I was lucky enough to have a conversation with Dr. Grossman a few weeks ago in his office, and he is a wealth of information. And I saw myself in some intersections being in New York. Uh, um, um, and being a Columbia graduate, and I'm a Barnard graduate, we share a university together.
That's right. And I was just general studies. You were,
Yeah, it
you were the
doesn't
real.
matter. So I always say that you get a Columbia University education.
Right.
Doesn't matter what school you're in.
Now, about
Yeah.
to have my 45th college reunion this week,
Wow. I did
virtually.
my, yes,
Virtually.
exactly. Exactly. Well, welcome. And I'd love
Thanks for
to,
coming.
throw out the question of so you did your residency at Kings County Hospital,
Yeah.
but you did your medical school at Downstate, which is
Mhm.
technically across the street. But
Right.
it was at a time when people were trying to grapple with what this thing, HIV, which wasn't named then, was happening to communities around the world, and specifically in communities in New York City and LA. So can you talk a little bit about that?
Well, sure. I mean, at
Mhm.
the beginning, nobody knew what was happening. Nobody really knew anything about it. So I went to medical school in 1979. Downstate and Kings County are in the center of Brooklyn in Flatbush, which at that time was pretty much a major, I guess the most of the population was people of color, and especially a large Caribbean population, large
Mhm.
Haitian population specifically. And it's a big city hospital. It was forget how many hundreds of beds, three huge buildings. Well, it was actually about 20 buildings, but three huge hospital buildings,
Right.
very old, no air
Mhm.
conditioning, 16 bed wards, roaches crawling on the patients. It was a little bit of third world medicine right in,
I
in, uh,
absolutely.
in New York City.
Mhm.
In 1981, when the first cases were described, we didn't know that we were seeing anything. I mean, I can remember that we saw cases that we thought were endocarditis, so infection of the heart valves. We saw a lot
Mhm.
of intravenous drug users,
Mhm.
and they would suddenly, their lungs would suddenly explode and white out on the X-ray.
Mhm.
In retrospect, that we were probably seeing pneumocystis, but we had no idea at the time that that even existed, outside of transplant patients. I mean, nobody had heard of that disease.
Right.
Um,
How soon? How early did you start seeing those? I mean,
well,
they're.
I hit the wards as a second year student. We started being on the wards, and that would have been about 1981.
Okay.
And so we were seeing those early. By the time, so 1981 was when the first cases were reported, but there were five. Remember, there were five cases reported.
Mhm.
So it didn't really, we didn't see it affecting our patients. There was, five homosexual men.
Mhm.
Um, and it was spreading within certain community in New York and LA, but mostly in New York. So we just weren't even looking for it.
Mhm.
We didn't know what this thing was. In 1982, when I was a third year student, actually there were at that point a few of us who'd come out. I came to medical school being out of the closet.
Mhm.
I had a break between college and medical school. We didn't used to come out as early now as the kids who are coming out at 10.
Right, right.
But by the time, by third year, there were four or five of us, and four of us we actually did a presentation on LGBT. Well, at that time it was lesbian and gay medicine. That's all it was,
Hmm.
because that wasn't something we were taught at all. And one of the things I remember we mentioned was this disease that people were sort of talking about that seemed to be hitting a specific group of people, and nobody knew what it was, and nobody knew what was causing it, and it didn't really seem to be spreading that much. We really didn't know what we had.
Hmm.
And so
Hmm.
that was 82 already. In By the time I was an intern in 83, Kings County had 5% of all the recognized AIDS cases in the world. So,
Mm.
over that 2 or 3 year period, it suddenly became something that people knew something was going on here. But those first couple of years, people really had no idea. If you see the normal heart and you hear about, Larry Kramer and his friends, I mean, he knew so many people who were dying because that was the group where it was spreading most rapidly at the beginning. But those weren't
Hmm.
weren't the groups of people that I associated with because I was much younger.
Hmm.
And it
Hmm.
wasn't the groups of people that many people did. So
Hmm.
that was at the beginning. But I think in retrospect that we were seeing HIV in our drug using population earlier than
Hmm.
we first recognized it.
There was a conversation with a physician out of LA who worked in Orange County, I believe, and she was a infectious disease, and she was also talking about seeing cases of something as early as the late 70s, and not no one understanding why this was happening.
Right.
But
So they used to talk about gay bowel disease, for example, which
mm,
was
mhm,
probably, some opportunistic infections in the gut that, it was always, okay, man, have all these parasites, get all these STDs.
mhm,
But people were having all of these abdominal symptoms that nobody could figure out. That
mhm,
they were being treated with Flagyl, they were being treated with other things, but nobody really knew what it was. So they called it gay bowel disease.
mhm, mhm. How very interesting. Yeah.
Yeah. Well, everything. Well, remember, it was first called gay-related
Great.
immunodeficiency,
Yeah.
as if somehow being gay could make you immunodeficient.
It's interesting that even when they had the few cases of women who were positive, they would call them that they got grid. And so it seemed like an oxymoron to me that you would call this disease by an individual group, but when you found out that it didn't always pan out that way, you still called it that, you
Right.
know.
When we saw intravenous drug users who had obviously AIDS at that time, and but they kept trying to say that they were probably having sex with men somewhere. And we saw women, especially from the Haitian community, we saw women early on,
Hmm.
and it was a long time before it was recognized for sure that women got it.
Hmm.
But they
Hmm.
were right in front of us in the hospital.
Right,
You know,
right, exactly.
remember, this was a hospital where we had a whole ward of tuberculosis patients in the early 1980s.
Hmm. Hmm.
25 people with TB who were being treated. So this was a population that didn't have good access to healthcare, that wasn't getting the kind of treatment that other places getting, or getting the kind of publicity that other places got. So
We did a film discussion series on the Allison Gertz story, and I understand you were part of
I
the
knew
board
Allie's
of that.
I knew Allie's
Yeah,
parents after she
right.
passed. Yeah.
Mhm. That must have been interesting because we were talking about how um women were part of it, and yet when she came uh, to the public eye, it was almost like that's impossible. Um,
It was, you have to go back. I One of the lessons that I learned about public health messaging, that stuck with me, came from watching Nightline. I don't know if you remember that show.
yes, I do.
It was a
Ted Koppel.
it was a Nightline, and it was Matilda Krim, and there was an
Mhm.
article that came out in Cosmopolitan magazine by
Yes.
a psychologist or a psychiatrist in New York that basically said women don't get HIV. This is all just a plot by the gay community to try to get money. So Matilda was on with him, and Matilda was one of the most brilliant people
Yeah.
anybody ever met. I mean, and she was one of the founders of AmFAR,
Mm,
and she was an immunologist, a scientist, and she gave that up to run the organization,
hmm
work
hmm
on funding HIV research. So, and Matilda was a person. She was married to the head of Miramar Studios. I mean, she was a
mm,
her husband was very wealthy. They had this fabulous townhouse on the Upper East Side. Uh,
right.
and she didn't need to work, but
hmm
she did incredible work for her the rest of her life.
hmm
But anyway, so she was on there, and this guy is saying it's absolutely untrue. Women don't get HIV. This is a plot. He was very, very blunt and forceful. And her response was, well, to the best of our knowledge, from everything we know, she spoke like a scientist. You know,
Right.
we think women are getting this. He won that debate, even
hmm
though he was completely wrong. And it taught me a lesson about messaging, that it has to be simple and it has to be direct and it has to be stuff that people can absorb. Uh,
hmm hmm
the message around COVID right now has been so complicated for a year because we were learning as we were going along. And I think the press was really irresponsible in not teaching people how to deal with science and development. I mean, those of
hmm
us in
hmm
HIV, that's been our life for 40 years.
Right.
But
Right.
for most people, they don't understand how science works and
Right.
develops.
Right.
But in any case, the message now, get vaccinated because that will bring you back to life, is
hmm
a clear cut, easy, accessible message that can be forcefully given. And
hmm
if you've been vaccinated, you don't have to worry anymore. I mean, those are very strong messages, but that's things that we learned in HIV.
Right.
You needed to give people. I mean, in this
hmm
country, everything was very complicated. Well, I mean, clearly in places like Australia and in England and most of Europe, the message they gave about HIV prevention was use a condom for intercourse. Don't, pardon the expression, don't fuck without a condom.
hmm
That was it. Okay. They didn't
hmm
talk about oral sex. They didn't talk about what if it splatters on you. They didn't talk about anything else. Okay.
Right.
Their infection rates were far lower than ours because we put out such complicated messages that people just threw their hands up and said, there's nothing I could do. I'm going to get it.
hmm
And I
Yeah.
think that was, anyway, that was around women and HIV. But,
Right. Right.
Allie, Allie broke a lot of barriers because she was young, she was pretty, she was privileged, and that because most of the women that we had been seeing were in communities of color, especially Caribbean communities, were
hmm
IV drug users, were not people that people related to.
Right. 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 For those of you who are just joining us, this is the World AIDS Museum Spotlight Series with Dr. Howard Grossman. You have Andy Ruffner and Raquel Lopes from the World AIDS Museum enjoying a wonderful conversation with Dr. Grossman. Um, I'm always interested in the work you did internationally. You had been doing one of our conversations about the clinic that you set up in Nepal. And how did you get to Nepal? How did that happen?
Well, one of the, I mean, this epidemic and pandemic was such a disaster in so many ways, and so many things. But I think for many of us who did it, it gave us a chance to travel, to meet people from all over the world, to go to AIDS meetings everywhere, to experience other cultures, to experience what other people were doing, what other healthcare systems. Um, I feel very lucky that way in the people that I've known over the years and the places I've gotten to go. So the Nepal thing, I had done some teaching in Russia and Eastern Europe. When Russia opened up, with Glasnost and everything, there were a number of community-based organizations that formed, non-governmental organizations. And they were bringing over American doctors to teach about HIV. The HIV system in Russia was just a nightmare. There was this very powerful woman in St. Petersburg, and Elena Gasanova, and she was this short little woman with flaming red hair. She was about 75 years old, and she was sort of the godmother of HIV in Russia. And she was a really powerful personality. Um, but sort of she was spearheading a lot of this, and but these non-governmental organizations. So they had us coming over teaching. I was in St. Petersburg a couple of times, in Moscow, and in Irkutsk in Siberia, and in Belarus. I actually went to Minsk,
Mm,
uh,
mhm.
the most Stalinist city in the world.
Really?
Yeah. Well, it was bombed to the ground in World War II. There were only a couple of buildings left standing, and when they rebuilt it, it was under Stalin, and he had his own style of architecture.
That is true. That
Yeah.
is true.
But anyway, so I had done some of that, and there was a woman who was helping to place physicians in mentorship um, positions in different countries to spend time teaching. And she had arranged with the Nepal Red Cross this joint project. And so at first she wanted me to go to China. Then that fell through, the funding for that fell through. So she said, would you go to Nepal? And I'm like, okay. And then never even thought about it.
Mhm.
And I said, where? And she said, well, the name of the city is Dongari. And I looked it up and I couldn't find it. uh, but she said, but you'll be going once a week to this other city called Mahendranagar that's like 3 hours away by car. Uh, and
Mm,
and so I found a sentence about Mahendranagar, and it said Mahendranagar. If you enter Nepal from India, you may come through Mahendranagar. Why somebody would stay here, we have no idea. That was the only thing that I could find that was on the internet at the time
mhm,
about this. So this was a city that in what they call the Terai, which is the southern part of Nepal, is very flat and wet, and very wet in the winter, dry in the summer. It can be 120 degrees in the summer, and in the winter it's like 35, and
mhm,
very foggy, and it's very flat.
mhm,
And the far west of Nepal, which is the area that borders India, um, was until the 1960s inaccessible pretty much to anybody who didn't grow up there because of malaria more than anything else. They have 5 of the most poisonous snakes in the world. It's a malarial swamp in the summers. It was not an inviting place. Apparently, caravans in the Middle Ages used to make a wide circle. But
Won't have none of this.
once they had better malaria control, it was better. But this was also the center of the Maoist rebellion that shook Nepal for about 15 years. So when I went, it was 6 months past the armistice. It's about a 3-hour flight from Kathmandu west.
Mhm,
You land in a field with cows. And I stayed in the best hotel in town. That they used to have a big cauldron that they would heat up my water for in the morning so that I could take a
mhm,
shower with a bucket and a thing. And they didn't want me to leave the hotel because they were just past this armistice, and they were I was the only American, only
mhm,
Westerner, period, in this city of 250,000 people. And
mm,
because of this rebellion, they had been under a curfew for 13 years, where they not only had to be in their house, the lights off, but in bed by 7 o'clock. And so
mm.
this was the only place there were no movie theaters, there were no restaurants, there was no art. It was people just lived their lives and got through. But wonderful people. I mean, just
Mhm,
really nice. So this was the regional zonal hospital. And the clinic was but it was a big hospital, but it was, all open, sort of open air. There were bare
mhm.
light bulbs hanging from the ceiling, stained mattresses. I mean, dogs walking in and out. They had no general anesthesia for doing the GYN procedures that they did.
Wow, wow.
So it was, but some of the doctors were very educated, and right outside they could have their private practice, and they had CAT scans. And so if you could pay for it, you could get some pretty good medical care, but if you weren't
Mhm.
paying for it, you were in the place with dogs walking through. And the
Mhm.
HIV clinic, they gave them a building away from the main hospital. And next to it was a little fireplace, and the behind it where the doctors lived. There
Mhm.
was a special doctors area, and the servants for the doctors used to come and burn their garbage right next to the HIV clinic because they didn't want to take it to the main incinerator. So they had just done it, and so the smoke would be going in.
Oh my goodness. Yeah.
And when I started there, they had just, what happened was WHO had just given them drugs for the first time.
Mm.
And they were mostly
What
drugs
year was this?
that
What
stopped
year?
using. That was 2007.
Okay. Yeah.
They were mostly drugs that we had stopped using years before. Now, the
Mhm.
epidemic there was very different from the epidemic in many other places because most of the epidemic was there, so north of there, when you get to the hill country, which is like 11, 12,000 foot hills,
Mhm.
a lot of
Mhm.
farmland. Then you get to the Himalayas, but it was a lot of farmers. And the farmers in the winter would go to India to work as as workers and guest workers, and they would be without their families, and they would visit prostitutes, and they came
Mhm.
back with HIV.
Mhm.
Many of them infected their wives. The wives were, many of them were past childbearing years, so you didn't have a big pediatric epidemic, uh,
Mm.
and the men died. So what you had was an epidemic of widows. Okay,
Really? Yeah. Mhm.
and it was fascinating because the kids I worked with, they were mostly younger people, um,
Mhm.
and people would have 2 and 3 and 4 jobs, and they'd be setting up their own like non-governmental organizations and looking for money and try, but
Mhm.
it was really hardworking people. Anyway, we started talking about safe sex, and they said to me, but they're widows. And I said, yeah, but they're relatively young and they're single women, and they're like, but they're widows. And so, in that culture, once you're a widow, you're not going to have sex anymore, which of course probably isn't true.
Mhm.
Um, but it was a real cultural thing, cultural barrier to get them to start talking to these women about safe practices and things like that.
Right. Right.
But also the doctors were very overburdened, but they had sent a few doctors to Kathmandu for training. Those doctors were supposed to be running the clinic. So I got there, and I didn't want to be pushy American. And so I just sort of watched how things happened. The first day, the doctors came in, they were supposed to be there half a day. They came in for like an hour and a half.
Mm.
All the patients were standing around them, and they just like conducted their business right in front of everybody. Didn't touch a patient, just like one patient would sit down and everybody else was around listening. So the next week I sort of set up little stations, and then I taught the nurses how to take a history, which they'd never been taught to do before,
Mm.
how to take blood pressure, which some of them had never learned. And we had little stations for people, but I wanted to bring the patients in one by one. So we gave them numbers. But they, this is how stupid I was. It turned out that most of them were illiterate. And
Mm.
so they would just put the number down somewhere, and they had no idea what they meant. So the next week we had to learn to pin the number to the person, and so that we knew who was next. And then
Right.
we bring
Right.
them in one at a time and put them through the process, and have a sort of streamlined process. But that was most of what I think I brought to the table, was organizational skill more than anything else. um, which there was a real difference in the way we practice medicine. Um, but also, the culture is so different. Right? In that other city that I went to, Mahendranagar, for example, the WHO had given them a T cell machine.
Mm.
They never used it because nobody taught them how to use it or sent them the reagents. So they had
Mm.
this very expensive piece of sculpture sitting in the lab.
Oh.
And I said to them, well, didn't you call anybody from WHO? And they were like, oh no, we couldn't do that. They'll send somebody when they want to. And I said,
Mm.
I don't know. They really want you to use this machine, call them. But it's a very in some ways, it's a culture that says the gods will provide when the gods are ready. Uh,
Mm.
And, I mean, part of that is a very kind, nice culture, but part of it is that
Mm.
they didn't ask. So I was a little pushy, but it was a very good experience. I'd never been in that kind of environment, and people were really, really nice.
Mm.
So
And I
what
think
was it
I think we
like?
made a difference.
Sorry, I'm just wondering. So after doing that, the adjustment in coming back, I'm
It was only
wondering.
8 weeks. It was only 8 weeks. It was
Yeah.
pretty short, but it's I think the biggest thing for me was realizing how easy everybody wants to go overseas to do something because it's easy to make a difference. It's just so much harder to make the same kind of difference here because of our medical structure, the ingrained things, all the bureaucracy, all of that stuff that when there's so much nothing, anything you do can make a difference. And that it really made me see why people were so eager to go overseas instead of doing the work here. I mean, meanwhile,
Mm.
in South here, we had, a pandemic going on and people not being able to access care, but nobody was focused on that.
Right, right.
Mm,
Wow.
mm.
That was
Mhm.
that was my international experience, but you know, it's
So how did you get down to Florida?
well, I was in New York. I was in New York. I moved to Washington in 2004 to run the American Academy of HIV Medicine. So
Hmm.
that was an organization I helped to found. But our founder, the person who was behind the whole idea, was sick with colon cancer, and
Mm.
he eventually died at young. And that was Scott Head, who was the head of the first presidential AIDS commission.
Hmm.
And so we needed somebody, and nobody else wanted to take it on full time. And I said, okay. And so I gave up my practice and moved there.
Right.
I did that. I moved the organization from LA, where Scott was, to Washington, and
Hmm.
and I was there for 2 years. Uh,
Hmm.
After that was when I started to do some of this international work for a couple of years.
Hmm.
Um, and then I was in San Francisco, where I went. There was one of the first HIV doctors was Marcus Conant, one of the most famous
Hmm.
HIV
Hmm.
doctors in San Francisco. And Mark asked me to come out there to work with him on rebuilding a practice, because he was going back into practice. And we tried, and San Francisco is such a horrible market for private practice in internal
Hmm.
medicine. It's so controlled by several insurance entities that it's very, very hard to break into that. So
Right.
I finally said to him, "You're wasting your money on me," and that was when I went to Fenway for a year, and then I went back to New York to be closer to my parents, who were aging at that point.
Hmm.
So I reopened my practice in New York. I forget the question you asked me.
How'd you get to
How did I get
Florida?
to Florida?
Yeah. Yeah.
Private practice, especially solo private practice, has become an almost impossible thing to do. And
It has. Yeah.
basically, to be honest, all my retirement money went into keeping my practices going, because I opened another practice in New Jersey because there was no LGBT practice in the state at that point.
Hmm.
I was just working 6, 7 days a week and losing my shirt. My younger brother and sister, did an intervention and said, "You can't be in private practice anymore." uh, and so my brother works for Cleveland Clinic down here in Florida. He's a hematologist, oncologist, and he was very happy here, and he convinced me to come down and work there. So I
Hmm.
did that for a couple of years.
Wow. Wow. We are very lucky to have you in our
Yeah.
backyard. That is for sure.
Thank you.
It's really, really impactful.
It's been an
And you have,
interesting
mhm,
practice. I mean, it's been an interesting practice because I
yeah.
do primary care, but I focus on LGBTQ health and HIV
Hmm.
treatment and prevention. I'm seeing a
Hmm.
lot of transgender patients, which
Hmm.
was never my specialty. But when I was at Fenway, it was understood that every primary care doctor needed to be able to do hormone therapy, at least to start it. And
Right.
there's nobody down here willing to do that. Very few people. So
Hmm.
just being willing to do it, people find you. And that's been very rewarding.
Well, Andy.
No, I just want to say, I mean, I think it's a really interesting thing, this whole process of providing LGBTQ medicine as well as HIV, and that I'm just wondering what your thoughts are about. Do you find that it gets confusing to people, or it turns people off one way or the other about whether you're in the right spot? Like, are you naming yourself correctly? Because I think that that's a lot of confusion that people get about it. Is, well, I don't want to go there because it's mainly about HIV, or I don't want to go there because it's mainly about LGBTQ. What do you, how do you see that playing out?
Well, the confusion's been much more about, for straight people, really, which is part of why I teach my staff to say we are a primary care practice that takes care of everybody, but Dr. Grossman specializes in LGBTQ health and HIV treatment and prevention. Because when, in the old days, people found you through friends. Then in the 90s, suddenly they found you through a book because you were in their insurance plan.
Right.
You had some bad experience where people were like, these old people would come into the office going, oh, it's a bunch of faggots. And I had to ask a couple of people to leave, actually say, this is not the right place for you. So I made it very, very out there that this is who we are. I've got pictures of Divine hanging on my walls. It's pretty clear that I have a whole Broadway Bears room.
Yes, you do.
It's pretty clear who we are. And, like I said, I'll take care of anybody who comes in, but they have to know that this is where they're coming. But the HIV, I always made it very explicit, and most of the primary care doctors in New York did HIV work as well. So I think people knew that, you couldn't, unless it was somebody in infectious disease, you couldn't really say, you didn't know that they were positive just because they went to a certain doctor.
Right.
But nobody ever knew who was positive or negative anyway. I mean, in the early 90s, a group of us got together who were HIV negative men working in AIDS. And during some of the worst years, we all knew each other. We all thought, everybody in the group thought everybody else was positive. And sort of a shock to find out that we were all negative and we were doing this work. That was a really great support group that we had.
Exactly.
And very needed. Yeah.
Yes, very much so. Very much so. I think we're coming to that unfortunate place in time, because I could sit here and talk to you for a while. And for those who want a great doctor, you are it. But even just going through your hallways and having the stories of what you have up in your the artwork and the pieces that you have is incredible. So I want to thank you for taking this time to have a conversation about your experiences and your history with HIV that has been eye-opening. I mean, from the beginnings in Kings County and downstate in Brooklyn, New York, to being the executive director of the American Academy of HIV Medicine, to the awards that you've gotten from ANFAR and others, and for the passion that you have and the advocacy you have around HIV. I think it is imperative that we continue to have people like yourself advocating for people, as well as education around HIV. And that is so important in this day and age. So I thank you for that.
Thanks for coming.
Yeah.
I'm just, the thing that excites me most these days is helping to bring the next generation along. The next generation of activists, the next generation of people who feel like you and I do.
Absolutely. Because it is the next generation that will continue to carry on, and that it's motivational to have people like yourself here to help spur that on. So thank you. Thank you. So we end this by, of all the things you're doing, Dr. Grossman, what in the world do you do just to relax?
Uh, these days, I'm the board chair of my condo complex.
That
Ooh,
is a
that
challenge.
does not
I
sound
don't know
relaxing at
I
all.
don't.
No, well, it's Wilton Station, so it's definitely not relaxing. Um, I'm a big theater person. I used to live 3 blocks from Times Square, so I used
Mhm.
to in New York. I saw everything. Down here, I've managed to discover some theater, and I'm really looking forward to getting back to it as the theaters reopen.
Absolutely.
I find that I can lose myself a bit in those
Yes,
places.
for sure. And I don't want to forget your fur baby because he is gorgeous.
He's there.
Gorgeous. Let
He's
me see him. Let
right
me see.
there.
Look at that. He is
Dante.
absolutely gorgeous.
Hey.
Hi.
Oh, look.
Yeah,
But
keeps me sane, keeps me,
yes.
yeah. The thing about a dog is like, no matter what goes on in your life, I'm sure it's the same with kids. You have to be there to take care of them.
Absolutely.
Except the dog never grows up.
Just stays the same, loving and caring.
Exactly. So this was great. Thank you. I appreciate it. Like I said, the HIV epidemic was a horrible thing that should never have happened.
Mhm.
But I've met the most incredible people. I've been lucky enough to meet so many people who were involved in things, so many people whose names and that's I feel a little like Zelig sometimes. Just it's always there in the background.
Exactly. Exactly.
Yeah.
Wealth of information. Wealth of information.
Well, I don't know if I said that to you, but as the histories of ACT UP come out,
Mhm.
there's all kinds of arguments about what story and who's telling the story. And it really
Mhm.
is like Hamilton, who lives, who dies, who gets to tell your story. And
Exactly.
to watch history being told and how it gets twisted in so many ways. When Randy Schultz wrote his book, I mean, I knew Randy and the band played on. I was at some of those meetings he talked about. It didn't happen exactly the way he said. He took a lot of
Mhm.
literary license. Plus, he
Mhm.
was very angry about having HIV. Uh,
Mm.
so, but that becomes the story that everybody tells.
Absolutely.
And there's a new book by Sarah Schulman just came out this week, and that's supposed to be, a much more hard-hitting and honest view of exactly what was going on at ACT UP and stuff.
I think it's important to have a lens where you can step back a little bit from it to really see the totality of it.
Mhm.
And we're getting to that point where we're far enough away from the beginnings that we can actually, one, be able to speak about it in a full conversations and all the intersections that happened during that time. So I think there's a lot of information that's going to start to come out
Mhm.
differently and more fully that
Mhm.
I think is going to be really important in telling the story of HIV.
Yeah,
And I think
those
that's
different voices.
yes,
There were a lot of people
abs-
there. Yeah.
absolutely. And we honor the people that were the umbrella group that brought this to the forefront. And we're looking to honor the people that were helping. They may not have been the front person, but they were just there next to them.
Yeah.
And they were as important as well. And so the more we tell the story here at the museum, the more those intersections get to be told and
Right.
highlighting how they work together. You know.
Yeah, it's funny when Clinton became president, and the Don't Ask, Don't Tell stuff was happening. For whatever reason, I got a bug up to call a whole bunch of people together because I didn't think that the gay community was really responding as it should
Mhm,
to
mhm,
it. So I put a whole bunch of people that I thought were important. To get in a room and strategize. And I remember one of those people said, "Well, who the hell are?" They were mostly, a lot of them had been giving a lot of money. And
right.
they said, "Well, who the hell are you?" And I was like, I was stuffing envelopes at the National Gay Task Force when it was, in a dark corner of a building back in the 70s. Who are you? You
Exactly.
know,
Yeah,
but the
exactly.
envelope stuffers never get any recognition,
Mhm.
you know.
And I think that they should. And that's
Sure.
one of the things in telling the story in its wholeness that you get to talk and uplift the stories of the envelope stuffers who did some of the work that made us be where we are today.
Exactly.
Um, yeah.
Yeah, they
And
didn't necessarily get in front of a camera.
no, 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 not at all. And so thank you again.
Thank you.
This
That's
has been
great.
an incredible opportunity, and we look forward for other conversations
Great. Thank you
in
so
this line.
much.
Yeah.
Love the museum.
Uh, and so stay tuned to our next Spotlight series, which will be on June 16th with Dr. Mara Lee, who also came from the New York area in a different way, but worked out of St. Vincent's Hospital during her residency. So we get to
It's wonderful.
hear, so we get to hear a different perspective of the same time. So we look forward to it. Thank you again, Dr. Grossman, and stay tuned to the next one. And have a great day.
Thanks.
Thank you.
Bye, everyone.